The opinions in this podcast are all our own.
But the businesses are real chamber members.
It's a chamber chat.
Coming to you from Wahoo, Nebraska. Chamber Chat with Kate
And Kat.
Welcome to Chamber Chat with Kate.
And Kat. I'm Catherine Nygren, owner of Found and Flora Flower Shop.
And I'm Kate to Coast, owner of Kate to Coast Photography. This podcast is everything Wahoo Chamber of Commerce.
Well, Kate, we have another guest in the studio.
I know. It's just like guest after guest.
I know, which makes it more fun.
And we both know him well.
I know. I've been there way too many times this year to count.
Not too many people take a deep dive into my mouth.
Right. Well, if you haven't guessed, we have Dr. Cory Foland of Wahoo Creek Dental with us today.
Yes. Thank you so much for being here.
Yeah, thanks for having me. It's a pleasure. Happy to be here. And good to know both of you pretty intimately.
Yeah. Yeah, I feel like you have to be comfortable with your dentist. Like just like
Right.
like a
It's kinda up close and
doctor.
personal.
Yeah. Yeah.
Yeah.
Yeah, because there's not too many people you just want looking in your teeth or
No.
your mouth. No. No.
That's why maybe it's nice you didn't know me growing up and I wasn't from here.
That's
There
true.
you
That's
go.
true. Yeah, that's true. Because even though like the past dentist, I mean, I had him literally when I was all the way from a kid
Oh, yeah.
to an adult. When I didn't live here, I would come back
For
to
your dentist
go.
appointment?
Yeah, like I would make sure, like when I was home for Christmas, to get my, like
cleanings
cleanings done and
Huh.
everything, because I was like, I don't. Who else would do it?
Right.
Like I'm not going to a new one.
Yeah.
But yeah, it might be weird if like you were like someone I went to high school with or something. Be
Yeah.
like,
Someone you babysat when you were young.
yeah.
Are you sure you should be using that drill that close to
Yeah.
your face?
So tell us, Cory, like how long now that you've been in Wahoo, and kind of give us like, I don't know,
Yeah.
a little story.
How'd
like,
you end up here?
Yeah.
Yeah, so we've been here 3.5 years now. Starting off, I guess my journey into dentistry was I started college as an architecture major.
Oh, really?
I did that for
Oh.
2 years. And I liked kind of engineering, architecture, design, working with my hands. And so I really actually loved the schooling of architecture, model building, making things look pretty, talking with clients on kind of what they wanted. But I felt like the profession was a little bit less of the fun stuff and more of the boring stuff that I didn't like so much about architecture. So I was kind of, dentistry was always something that was in the back of my mind growing up. And so I shadowed some dentists, and there was a overwhelming, almost everybody said, man, the artistic side of dentistry, you have, changing someone's smile, making things look
really?
natural,
Yeah.
making sure everything comes together right. And I appreciated that, and the fact you're working with your hands all day, every day.
Literally.
Not stuck behind a computer was something
Right.
that really interested me. So after shadowing them, I kind of changed course in college, and then the rest was history. So went to dental school, and then after dental school, my wife and I, she's from a smaller town, Doniphan, of about 1,000 people.
yeah.
I'm from Grand Island. We knew we wanted something smaller than like Lincoln, which is where we were living at the time, just for smaller schools for our kids and stuff like that. And just came across Dr. Swanson's practice here, and he was kind of looking to get out. And we fell in love with the town, and we liked it, and thought it'd be a good opportunity, so we jumped on it. So
Wow.
Nice.
3.5 years later, here we are.
Here we are.
Yeah.
It's been good.
I never would have thought of dentistry as being a creative, profession.
Yeah.
I thought it would be like very scientific, very that, but the creativity part, I think really surprised me.
Yeah, that's why I kind of like. So you didn't have like the scientific side of it in architecture, which also my brain works really well there. So I felt like I was working that, was it the right side, the creative side of my brain a lot, and not so much the intellectual side.
Sure.
Okay.
So now I kind of get to have a little bit of a balance of both those, which is nice.
Yeah.
Interesting.
And I bet it is pretty amazing to, like you said, like shape someone's smile, shape someone's, because everybody sees this.
Oh, so your teeth are pretty important.
Yeah.
Yeah.
And, you don't want to be walking around going, So I just, now that you're saying that, I'm like, okay, I can kind of see how that would be something where you're like, I can literally shape someone, or
I could have an impact on it.
Yeah.
and on their life.
Oh yeah.
Because you think, like, if you don't have health, like if it's not healthy, or you're not wanting to smile, because I do have a family member that had really bad dental hygiene and lost, as at a young age, lost a lot of teeth, and then she did get everything fixed and healthy, but she wouldn't smile, and if she smiled, it would be a closed smile, and it wasn't smile. That you knew she wanted to laugh, or she wanted just to,
she was holding back.
Yeah. And now she does, and it's it's her.
Yeah, it can make a huge difference, like mentally and emotionally, for someone, and a lot of people don't understand maybe what options are out there. They think they're just kind of, this is the way my teeth are, and this is the way it's going to be, and I'm just going to not smile. But
right.
That's part of our job that we're working on, is trying to present those, because some people either are too embarrassed to ask, or don't want to ask, or don't know that there's something else. So bring up, orthodontic, straighten your teeth. We can whiten your teeth. We can do veneers just to change your smile completely. So a lot of different options out there, and missing teeth, implants, things like that. There's a lot of really good options nowadays. So
that's awesome. And what all of the things, we know that you don't, in your office, we don't go in just for a cleaning. Like, there's other things that,
besides like cleaning in cavities.
Yeah. Where I feel like that's what most people think. Well, that's what I do at the dentist, and then I have to go somewhere else to, What else do you have?
Yeah, so there's a lot of, quite a few dentists out there that they do just kind of, they come in, you get your cleaning done, and then if you have some cavities, they fill the cavities, and that's about it. They don't venture a whole lot into the oral surgery side, or the endodontic side, or orthodontic side. What I try to do, especially in a small town where, you have to commute to those specialists, is keep as much in-house as possible. So we do obviously all the fillings and crowns and bridge work, and then we do implants now. So for anyone missing teeth, we do all the oral surgery in-house. We place implants. We do orthodontics. We do clear aligners, so kind of like Invisalign.
Okay.
If you're wanting to straighten your teeth out, but you don't want to go to Omaha every 6 months or every few months and do all those visits, we do it all here.
Right.
We do same day crowns. So I don't know if you guys have had crowns before, but a lot of times you come in, they prepare the tooth for a crown, then you wear a temporary for a couple weeks, and then you come back and you get your permanent one on. Those temporaries don't tend to stay on well, or they don't feel good and stuff like that, and you got to come back for another visit. But we've invested a lot in technology in our office, and so we make all of our crowns the same day. We have a milling machine, we have a kiln that fires the crowns, makes them nice and hard and pretty.
Oh, wow.
And then we get your final one on before you leave, so you don't have another visit.
Oh, wow. That's awesome.
That is crazy.
Yeah.
I don't want a crown, but I've never had to have one. But that is cool that you can, if you do have to have one, that you don't have to make multiple visits.
Yes.
That's awesome.
Yeah.
Yeah.
I know I have a crown, but that was for your time.
Yeah.
I'm pretty sure I had the temporary and had to come back and
do all the
you know that process.
Thing.
Yeah, and so we have like a digital scanner too. So it's like a handheld camera almost, where we take pictures of your teeth with that scanner, and then we have a computer where we see the model of your teeth, 3D model, and then we design how the crown looks all on the computer, so you don't have those goopy impressions, if you guys have ever had those before, where it's kind of this putty that goes in your mouth and you gotta sit there for a few minutes waiting for it to harden, and nobody loves that, so we got rid of that and try to make things as, sometimes when you're looking at the technology thing, the financial piece doesn't always make sense, but when you think about the value it brings to your patients, it makes it worth it.
Well, the more you understand about your teeth, the more you know how to take care of it and stuff. I know when I was just in, you showed me a picture of like one of my back teeth that needs a cavity, filled, and it's like, oh wow, like it's one that we kind of been watching, and he just like stuck a little camera in my mouth and took a picture, and you could see like exactly the tooth and the dark spot that needed to be fixed, and it was really eye opening, because it's like, okay, that does look bad,
right?
Yeah.
Because usually, like normally or before or whatever, you would just be like, okay, you said so.
Yeah.
Not that you're going to be like, oh, I want to dig your, your teeth, even if it doesn't have. But it's kind of cool that you get to actually see what's going on.
Kind of be more of a part of your treatment, you
Yeah,
know, unless like, okay, yeah, you told me I have cavities. I feel like that's always the thing of going to the dentist. You're like, okay, no cavities this time.
Yeah.
That's like, okay, that's all I know.
Yeah.
Cavity free. Should floss more.
Yeah, that's a good point. Is like, you know, just working on education for patients. So a lot of people are in the same boat where they don't know much about their mouth, other than, do I have a cavity or do I not have a cavity? But we try to take a, you know, a holistic approach where we're checking your gum health and your bone health every time, and we're kind of explaining that to you, what we're looking for and what we see in the areas we're watching, like you said, showing you with the cameras, areas that we're checking or areas we need to work on, so you can kind of, you know, we build that trust together and you can see what those problems are. And my job is, you know, to show you what you have and what's available for you, and then ultimately we'll talk about what's going to be the best option for you going forward.
Right. Hey there, listeners. Quick question. When was the last time you actually looked forward to going to the dentist? Yeah, we didn't think so.
But that might change after you meet Wahoo Creek Dental right here in Wahoo, Nebraska. Whether you're ready to straighten things out with orthodontics, restore your smile with some dental implants, or you're in a hurry and need a same-day crown, they've got you covered with the latest technology and a hometown touch. And here with us is Dr. Foland himself.
Glad to be here. Same-day crowns means no more wearing those awkward temporaries for weeks. You walk in, we scan, design, and place it the same day. We aim to provide a full suite of treatments with a personalized touch just for you.
So, if your teeth could use a little love, or you just want a dentist who treats you just like he would treat his mom, check out Wahoo Creek Dental.
Your smile will thank you. And hey, tell them your favorite podcast sent you. I think one of the cool things, I know, being in a small town, I had a toothache a couple weeks ago, and I was like dying with this toothache. So I called Diane, and she's like, "Are you in town already? I think I can get you in 15 minutes." You're like, what a small town thing that was, you know?
Right.
But it was like, I was dying. I was so grateful. I'm like, yes, I will be there. Trotted down the block.
Yeah, and that's definitely something we strive for. As you might know, our schedule has gotten pretty full, you know, for if you're needing a longer appointment, it can be tough to get in at some point. But if you're nearby and you're in pain, like, we do everything we can to try to find a good time for you to squeeze you in to at least help you out and start the process.
Right. See, like, help you be like, here's what's happening type thing.
Yeah.
Yeah.
Yeah, in a root canal, but
And that's one great thing about Diane is I feel like she's been there for so long that she knows everybody's like schedule and where they live and what they're doing on this day at this time.
where
So
they
like, I think
work.
she could come in at Tuesday at 3 because she gets off work at 2:30. So that worked perfect.
she small towns it.
Yeah, exactly.
Well, I know their mom's over here. And
Yes. Oh, that's amazing.
Yeah.
I love that.
how long has Diane been there? I mean, ever since I remember going, but I don't know if you had like a number in
I
your
want
head.
to say like 20 years now. She's been was with Dr. Swanson, I want to say, for about 16 years. And so with me for about 3.5.
Okay.
I believe, if I'm getting my numbers right.
That's
numbers
a
right.
wealth of knowledge
Yeah.
you just can't replace.
Yeah.
Yes, for sure.
I know.
Well, you talked about your schedule getting in. You've got something kind of fun coming up on your schedule that you were talking about before we got on the air.
Yeah, so we'll be closed for a few days at the end of April, beginning of May. We're taking the office to the Dominican Republic on a mission trip, so a dental mission trip.
Wow.
A few of us are going down, and we'll spend 2 days just kind of serving the community there. We set up like a little mobile dental clinic. It's kind of open air, but it's all covered and really hot. But we see a lot of patients through. We haven't done it before yet, but just a lot of patients coming in that, you know, are in pain or need dental work and they can't get it there or can't afford it. So we're going down for a couple days and we're providing dental work there, and then we'll have one day to kind of hang out and decompress after that, and then we're gonna fly back and then get started again on Monday. So
Wow.
yeah.
That's crazy. So you have to bring I'm sure you're going to bring all your own tools and
we'll
fly those down.
So we're working with, it's already a nonprofit group down there called Bright Island Outreach that does a variety of kind of healthcare solutions for people.
Sure.
Charitable contributions down there. So we do bring some of our own stuff. Some of our suppliers, they donate things. So donate, filling material and instruments and stuff like that,
nice.
that we take down there and we use. So
Interesting.
it's been good.
And then who all from the office is going? Everybody?
We'll have one assistant and receptionist, Diane, is going down. A couple of other assistants and hygienists. They have either newborns at home that they can't leave yet,
Yes,
or
yes.
they
There's
have
so many babies in
another
your office.
vacation that conflicted. So we're hoping to make it a regular thing, and
Okay.
so they can have opportunities to go later.
Sure.
That's fun.
Yeah.
Well, I hope you take a lot of pictures and put them on social media.
Yes.
So
Yes.
we can follow along.
I need one of the younger gals maybe to make sure to stay on top.
Stay
of
on
that,
top of
because
it. Yeah, I'd be like, you're on
That's
the...
usually not the forefront of my mind. It's
Right.
like, oh, I
Well,
need this
like,
picture for
let's fix
social
some
media.
teeth.
Yeah,
Yeah, exactly.
yeah. Have somebody be like, you're the social
You're the
media
designated
guru
photographer.
for
Yeah, exactly.
What made you think about going, or how'd you learn about it, or?
So one of the dentists I used to work for in Lincoln prior to this, he's kind of helped mentor me through this practice ownership and stuff like that. And he just set up last year. He set up this kind of missions outreach down there. And so last year was the first year they ever had it. So they were kind of working out the kinks all on their own, just kind of with his office. And then this year he opened it up to other offices coming down. And so it'll be fun. Yeah.
Nice. And I feel like if they didn't like it or didn't feel fulfilled or that they were making a difference, they wouldn't want to
wanna go
do it
back
again.
again. Yeah.
Right, they wouldn't be trying to grow it with it.
I think the only complaint they had was how hot it was,
Hot.
and how sweaty you were.
You know, like the air conditioning
Yeah.
comfort of your.
Yeah. They
Right.
tend to be. They said it was a pretty long day, pretty exhausting. Kind of they push a lot of patients through. I guess.
Oh, I
I suppose
bet.
to take the.
But then you get that one day to kind of relax and go to the beach and
Yeah.
hang out at the
Actually
pool
see
or
the
something.
sights
Yeah.
and-
Yeah.
Yeah.
So you have that in your, like, it's like you have that in the horizon.
Yeah.
So
Exactly.
that,
You get to do that at the end right before you come home.
yeah. Okay. So coming back to Wahoo,
Mm-hmm.
I have a question about, about teeth whitening.
Yeah.
Oh yes.
Because I've thought of that and want to do it, and I've looked at like things, and I'm like, well, I need to talk to my dentist, and of course I would talk to you during an actual like visit about it. But what if there's listeners that were like thinking like, oh, we would like to do that and not do, say, the things that you see on like TV or on TikTok where you're like, oh, does that work? And then I'm like, is that going to ruin my teeth? Like that's like my first. I'm like, I'd rather just not have.
Like I've taken good care of these.
Yeah.
Yeah. So what I've noticed is like a lot of the over-the-counter whitening products just don't quite have the strength to really get you to the level of whitening that a lot of people want.
Okay.
And so you end up having to go back and buy, multiple kits over the
Okay.
course of time. And then you end up like, man, this is getting expensive.
Sure.
And then the alternative is those like one time which is maybe what you see on TikTok, like those mouthpieces or the one time in office visits where it's like super high strength and you're using these UV lights and
Yeah.
like
whitening your
glowing.
teeth.
Yeah.
Those can cause more sensitivity.
That's what
and
I
so
was wondering.
Then you don't want to go
Okay.
back and do it again. You're like, this is
That
going to be
hurt.
really sensitive every time
Yeah.
I do it.
Right.
So what we do is we use that scanner, we scan your teeth, and then we actually, just this last month, bought a 3D printer. So we print out the models of your
Nice.
teeth, and then we make custom trays. So these little rubber trays that are custom fit to your teeth.
Okay.
And then we give you whitening solution that you fill those trays with. And it's a little higher concentration than what you would get at a Walgreens or a Walmart. And you use those, I usually say every day or every other day, just for like 30 minutes. And within a month, you notice a significant difference. And the nice thing is you get to keep those trays, keep them around, make sure the dog doesn't eat them.
Right.
But then in a year or 2 years, if you want to do it again, you don't have to get new
Purchase
trays or
the trays
anything. You
again.
just get some
the
new
new-
solution from us and put it back in there and then touch it up a little bit. So,
Interesting.
yeah.
That is
I didn't even know
interesting.
that was an option.
Yeah.
Yeah.
That's cool. Yeah, you said something about whitening earlier, and I was like, I'm gonna
Yeah.
I know.
ask about that.
Yeah.
Because I have seen that where those UV things. Well, I'm always like, is that healthy? Like, I mean, I don't know. Like, should I be putting that on my mouth?
Right.
Like,
Should
yeah.
not be glowing like
Yeah,
that.
yeah. It's kind of like those masks that people put on.
Yes.
Like they look
scary.
They do. But I do want to try it, but I'm like, is that like later down in the like years down, we're gonna be like, you shouldn't have done that.
Yeah, exactly.
Kind of like, when in the 80s you'd like put baby oil on and laid out.
Oh, yeah.
Yes.
And now we're like,
Now
no, stay out of the sun.
Yeah.
What has surprised you in like, being your own office and being the one in charge now instead of working in another practice?
I think
good or bad.
Surprised me.
Or what did you not
I think
expect?
one challenge that I'm encountering is that I like to be able to do everything and kind of have not control, but I like to be able to know everything is getting done right. And so I like to be able to kind of take on a lot of those tasks myself. And that's kind of why I, am trying to be that one dentist that does, kind of multiple different specialty areas. So I can kind of just treat you guys as best as I can, or how I would treat my own family. But I'm getting to the point where I'm like, okay, there's a few little things that I know my assistants can do that I need to relinquish, delegate a little bit, where like some of the scanning, if you came in and you got whitening trays and they're more than capable of scanning, sometimes I'm just like, I like to be the one that's there talking with you, getting to chit chat for a little bit. Well, they can do it. So that's one surprising thing is like how much there is for me to do that I need to kind of let go a little bit and let them take control and responsibility a little bit. So
is it surprising? I was going to say, is it surprising that that's your personality, did you know that you had that personality?
I think so. Yeah. Coming out of school, I was like, regardless, there's, different levels of dental clinics out there. There's like those big corporate ones where there's not a huge emphasis on maybe the quality of work that you're going to get.
Sure.
And so I knew coming in, like, man, I wanted to be small and not grow way too big, way too fast to where I'm no longer focused on the personal relationships and the quality of work I'm doing.
Right.
Because I want to be able to look at that work years from now and be like, oh yeah,
I did that.
Hanging in there.
Yeah.
And I did that.
Yeah.
And it's kind of nice. Like people come in and they get x-rays and I can kind of tell, okay, I can tell that's the filling I did and that's the filling I didn't do. So I can see like, okay, the extra time and commitment I'm making is really making a difference. So,
It's an investment. Yeah. Interesting.
Yeah.
And I could see that, especially when it's your practice. I could see where you would want it to make sure that everything is being done right. Yeah. Like, or to your standards. And, but then there's that other, again, that side where you're like, okay, I know that they're capable of scanning and
They're very nice assistants.
Yes.
But I guess on the same note is that as far as the specialty wise goes, is that, if there is anything that I'm like, this isn't, if it was my mom in the chair, this is something I wouldn't do. I would send you the specialist for this. I'm still not opposed to that. I'll send over for root canals for someone else to do, or an extraction or an implant that I know is going to be very tricky. I'm like, okay, if this was my mom in the chair, I'd have you go to the specialist for this. So it's something that I'm not afraid to refer out to a specialist, but I also want to do what's best for you. And if I'm completely capable and I know it's easier for you, we're going to do it in the house.
Yeah.
Yep.
Well, I love that because like you're saying about your mom, so you're looking at everybody in their chair like family.
Yeah.
And you're thinking about them and what's best for them. And so if you're like, yep, this is going to be too complicated, I'm going to send you somewhere else.
Yeah.
I mean, the patient is, I would definitely be like, okay, like I would rather you tell me that than, be like, I can do it. And then it doesn't work. Yeah.
Yeah. Yep. Exactly.
So yeah, that's great. I feel like you need like a tagline, something like how I would take care of my mom.
Yeah. That's a good one. Yep. I'll treat you all like my mom.
Yes.
One other thing we've developed over the last year is a kind of in-house insurance or membership plan.
Oh.
So a lot of patients that don't have dental insurance, are paying for everything out of pocket.
Right.
Uh-huh.
And then sometimes you'll have people, maybe I need to get insurance. And then they're shopping around for insurance. And the downside of dental insurance is it's not like health insurance. So there's a maximum every year.
Oh, really?
And it's a very low, the maximum I don't think has changed in like 50 years.
Oh, really?
So dental work has
Wow.
gotten a lot more expensive, and they still
Right.
only cover like $1,000 to $2,000 per year.
Yeah, that's not a lot.
So yes, if there's a fair amount, doesn't even need to be a whole lot of work to be done, but you get through that really quick.
Right.
So our membership plan is for those that don't have insurance or have insurance and feel like they're not getting a value out of it.
Sure.
It's just an annual fee, and all your exams, all your x-rays, all your cleanings are covered under that. And we've calculated out to where it's already cheaper. It's already a discount. If you don't get any work done, it's cheaper.
Really?
And
Okay.
then,
Like if you just get your cleanings.
if you just get cleanings and x-rays, it's still saving you money.
Okay.
Oh.
And then all the dental work you need on top of that is discounted without, it's a 20% discount, and then there's no maximum.
Oh, really?
If it's a $20,000 treatment plan,
Right.
you get 20% off that no matter how much.
How much?
Yeah.
That's a good deal. And especially if you have like years like me where you're there several times and it's only April.
Yeah. Yeah, exactly. Yeah.
That would come in handy.
Yeah. Yeah.
Yeah, that's great. Yeah, because I don't have dental, because every time it was the same thing, like shopping around for it. And I was like, well, I don't have, knock on wood, I don't have like major issues. Like I go twice a year for my cleanings. And I was like, wait, how much do I have to pay for this? I was like, I'll just pay out of pocket. And then again, knock on wood that nothing terrible
Yeah.
happens.
Yeah.
So that's great. That's a great service to have.
Yeah. That's something I kind of wanted to do from the beginning, and it just took a little bit for me to kind of decide how I wanted to structure it exactly.
Sure.
And just to make it beneficial for everyone.
Well,
going
yeah.
forward. So,
Yeah. That's
And
great.
one other thing is that sometimes dental insurance, whether they realize it or not, are like dictating what the patient wants. So if dental insurance isn't covering what's best for the patient, they're like, you can get by with something less. And then the patient's going to go towards, all right, well, insurance isn't covering this, so I'm going to do something that's the cheaper route.
Right.
Right.
And I'm always going to try to be a proponent of, okay, long term, let's look at what's going to be best for you.
Yes.
Regardless of what insurance is saying is best, because like implants, even though implants have been around for 20 years and they are their success rate's like 98%.
Oh, wow.
A lot of insurance doesn't cover any of it because
Really?
they don't want to, because they want to make money. And
Yes.
so they'd rather not pay for that and give you something
Wow.
that is a lot less comfortable for you, or you end up not replacing teeth at all.
Right.
But I'm like, okay, in order for you to have an overall good oral health, we need to replace these teeth with the best solution for you.
Right.
We lay it out and not let kind of insurance dictate what's going to be best for the patient.
Instead of putting a Band-Aid on the problem,
Yeah.
just get
Yeah.
to the best solution.
Yeah, exactly.
Well, yeah. And that, I hate how that, I mean, I don't want to get like super whatever about insurance, but it like, that drives me absolutely bonkers, because it's like if a dentist or a doctor is telling me like, this is what you need, and then the dentist or the insurance is like,
nah.
yeah. And I'm like, wait, how do you know?
You didn't have the camera in my mouth.
Yeah, right. Yeah.
Yeah, exactly.
So that's a great way for somebody to be able to go, oh, well, if I do this membership plan, then I'm going to get what I actually need and not the Band-Aid over
Yeah.
it.
Right,
For sure.
right. Not
Yeah.
what insurance tells me I need.
Yeah.
Yep.
What do you wish people knew about their teeth? Like, what do you wish people knew that they might not know?
You'd be surprised at like how many people just aren't keeping up with their daily home care. Brushing the right way and brushing twice a day, and the appropriate way to use floss. So that's one thing our hygienists are trying to educate people on, is just how to brush, when to brush, and how to use your floss appropriately, and point out kind of tricky areas or problem areas that patients might be having that we focus on, and to get under there and clean things right. Man, it just makes a huge difference on our job at the office.
Yes.
When you're doing things at home, we notice there's just a lot less dental work that's going to need to happen in the future.
That's interesting.
Yeah.
So the whole like, don't forget to floss at the end of everything.
Yeah.
Every
Yes.
appointment it's really
It is important.
Yes.
it's really
Yeah.
important.
Yeah.
Yes.
Yes. Yeah. And it makes an impact on just your overall body health too. All that bacteria in your mouth, when it's not taken care of appropriately, it's getting in your bloodstream and it's causing, heart issues and things like that. And studies have shown it's linked to several other health issues that if you just can stay on top of your oral health, your entire body is going to be healthier. So
That's interesting.
That's why I think it's great going. Oh,
I was just saying it makes sense that all your body's connected,
Yeah.
Right.
Like your teeth aren't separate and in a separate jar from the rest of your body.
Right.
Like they're all part of you.
right. Yeah.
It's all available here in Wahoo.
Yeah.
exactly.
Yes.
yeah.
A block from my work.
Yes.
Super easy.
Yeah. We like our location. We like our downtown location. So that's one thing I was like a year and a half in and we started planning, okay, how big can we expand in this building and in this setting? So, we were kind of looking at, okay, should we build somewhere else or buy a new building? And because we just had, a lot of new patients. We hired new hygienists and assistants and stuff. And so starting to get pretty busy and packed. But man, I have a hard time, I think, leaving the kind of historic downtown area. And if I can find a way to make that building work long term, that's something I want to do.
Meet the goals.
Yeah.
Is there 2 rooms, 3 rooms?
There's only 3 rooms in there.
In there. Okay.
Yeah. And so previously, the previous dentist it was really just himself and an assistant. A hygienist came in once in a while to help in. And so 3 rooms was perfect for
Right.
that. And now we have 2 hygienists and myself. One hygienist is part-time. So we're still we're packed, kind of busting at the seams a little bit at times. And so we're trying to find a way to add on without disrupting, patient care in the time being.
Oh,
that's
sure.
Get creative.
if you're doing some construction, if you got to take away some operatories for a little bit,
Right.
then there's no way to kind of keep going. You got to close down for a little bit. So
Right.
we're,
Right.
we're navigating that now on how the best way is to do that.
Right.
Right.
Yeah.
But growth is exciting.
Yeah. Yeah,
And
that
then
is.
offering new things is good.
Yeah.
So, yeah.
Yeah.
That's really
Got to break an egg
exciting.
to make an omelet.
Yeah.
Yes.
Yeah.
And saying I always love walking in and being like, oh, that's new. That's new. Even if it's like furniture or something like
Yes.
that.
Yeah. Yeah. I'd say my wife maybe had a
Had a
big
little.
impact on like the reception area. At least all the furniture in there she picked out, and so I think
Nice.
that was important to me at the beginning, just for someone to walk in and feel like that's their first impression of the place, and so I want them to get the impression that like, okay, this is a place that is invested in quality technology and the experience as a whole.
Sure.
And so our new patient experience was something we work on a lot, and just how to make people feel like this place has quality care and they really care about you and they build that personalized connection. So
Right.
always take plenty of time to get to know all the new patients that come in. We take a 3D cone beam x-ray on all new patients. What that does is it looks in all 3 dimensions at your bone and your health, looking for tumors, cysts, infections, things like that. Something that was unheard of 20 years ago, and now it's starting to get to be pretty common. And then we just briefly walk them through like the same day crowns we have, the 3D printers, all the technology we invest in just to make sure they're getting quality care. So
Are you getting it sounds like you're getting a lot of new patients. Yeah.
Yeah. A lot of new
So that's
patients.
probably why. Because I'm guessing you had from the previous dentist, you had some built in,
Yeah.
but I feel like, it sounds like you're getting,
Yeah.
and that's why you're busting at the
Yeah.
seams.
Yeah, exactly.
That's what the construction projects are.
Yeah.
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 That's
Planned
great.
Yeah.
That's awesome, though.
Yeah, it's been good.
Well, I think when people think about the dentist, nobody is excited to go to the dentist.
Right.
Like, woohoo, I get to go get my cavity filled. You
Right,
know, but when you have
right.
like a warm, welcoming environment, it feels very like up to date, professional. You've got welcoming faces. I think it just makes the experience more, enjoyable.
Yeah.
For sure.
Yeah.
Yes, because a lot of people don't. I probably hear it once or twice a day that, nothing against you, but I just really hate this place is what everybody says. I'm like, I know. I hear that all the time. So if I can make it a little less hated,
Right.
then I win.
Right.
That's a win.
That's great. It's funny because I'm like, oh, I have something in common with you because I have people that walk in there like, I hate getting my picture taken.
Yeah, that's true. Same boat.
It should be less painful then.
But I'm gonna be like, but it's not the dentist. That's what I'm gonna say.
Yeah.
It's not the dentist, but you're not gonna come out being like, oh, I have a root canal after your photo.
My face
shoot.
is numb.
Yeah. But I always do. I will love walking into your business because Diane is always welcoming.
Yeah.
Mm-hmm.
And then everybody that works there, it's always like, hi, Kate, how's it go? You just feel, I don't know. And I feel like for me, I have an experience of being there from a kid all the way on. And it was kind of weird to have you like new, because again, a dentist that I'd had for all my life. And then I was like, okay. And so that's why it's funny to be like, oh, that's new. That's new. Where's the posters on the wall?
Yeah.
Like on the ceilings.
Yeah, people had to get existing patients had to get used to a lot of changes, I think, at the beginning.
Mostly
Yeah.
talking.
Yeah.
You talk way more than the previous.
Yes.
Yeah, so that was, I walked in and I had to meet, 1,300 strangers in the first year.
Right.
And so you're like, okay, I really want to get to know these people and build that connection. So they feel like I know them and they know me. And it's crazy just how much I've gotten to know people in the last 3 years. We were at, my wife and in-laws were at Acapulco not too long ago on a Saturday, and I was just blown away by like how many people I knew there.
Yes.
Yeah. So it's good just to go around in the community and you're like, okay, really getting to know everybody here. And it's nice to be able to, they come in and they sit in the chair and I automatically remember, something personal about them, and we can pick up where we left off last time instead of having just the normal small talk chit chat that we had to do the first
look
year.
At the weather.
Right.
Now we can get a little deeper.
Yeah. No, that's great. That's great.
That's a lot of fun.
Yeah. And I feel like that's totally small town of like you're sitting having dinner and
Yes.
everybody.
You can't go
You're like,
you can't go anywhere.
Yeah.
Go to the grocery store without running into
I feel like your
somebody.
in-laws are like, you're a celebrity.
Yes.
Are you still actively taking new patients?
Oh, yes.
Okay.
Yeah.
I was like, that might be something people, if they're listening, they might be like, hey, I want to go down. And then I don't want them to go down.
He sounds like a nice guy.
yeah. And then they're like, sorry. We're
Yes,
maxed.
and that's another, like with the schedule, we're reserving as many spots as we can for those new patients that call in so we can get them in, in a timely manner.
Okay.
You can find us on our website, wahoo-creekdental.com, Facebook as well, and then just call in 402-443-4989 and Diane can get you set up there. So yes,
She can get you taken care of.
always
Yes.
taking new patients and answering any questions you have. So
Perfect.
That's awesome. I'm so grateful to have this in town.
Yeah.
it's been good.
Thanks for coming and chatting with us, letting
Yeah.
us know.
Thanks for having me.
All the things. Well, thanks for listening, everybody. And don't forget
To keep it local, friends.
This has been a chamber chat
With Kate.
and Kat.
See you next time.